So this is a older female patient with foot pain, and she comes for an MRI. And what sometimes happens, and this can happen to even more experienced radiologists, you scroll through the case here and suddenly you'll think, oh, hang on a second, there is a fatty mass here in the subcutaneous tissue on the medial aspect of the foot. And you can see there's a capsule. It's kind of like sharp here. There are not any no septations. It's kind of like even impressing or pushing the musculature a little bit away here. Here you can see how this is about, what's the size, so you can start to measure it here. Maybe it's even like this, and maybe even like this large. And obviously you start to think about what could it be, and you go to the fat saturated sequences and you can see, okay, it's there is no cystic component to this, there are no vessels really inside this thing. You might be going to the coronals, or you can see a tooth, or you can see this lesion here, which again, when you measure it, is about close to 2 centimeters in these diameters here as well. So you might start to think about a lipoma, right? Or any other fatty containing lesion at that location, but most commonly people think about lipoma. But, and that's today's quick tip, this is just a normal finding. So this is not a lipoma, this is just normal subcutaneous soft tissue, and should not be mistaken for a tumor, and certainly not for something malignant, and you should not do biopsy or whatever for this thing. And why is that? So you could argue, oh, but it looks like, yeah, but it doesn't. And so there is even a study that assessed this, and they call it a common pseudolesion, and it's about mass-like fat at the medial midfoot, which is exactly what we have. And this is a newer study from last year. It's not even a year old. And so let's have a look at the images here before we jump into the results here. So again, this is this exact same location. They did some measurements, and it's about this thing here and this one here. Our case is even more beautiful than their case here, but it's always at that exact location, and location is key in this instance here. So we can then move on. There are a couple of other cases here. This one looks also very lipoma-like, but it's actually just a pseudolesion. And let's see what the result actually showed here in the abstract. So subcutaneous fat at the medial midfoot often has a mass-like appearance that could be mistaken for a lipoma. It is important to recognize this pseudolesion variant and not confuse the imaging appearance for a discrete mass. So if you use the criterion of 1.5 centimeter as a cutoff, this pseudolesion was documented in that study here in about 14% of cases. So it's quite common, and you will occasionally see it. Normally, because it looks fatty, and if it's a little bit smaller, it doesn't jump your eye, but if it's big enough, it kind of like pops out a little bit. And this is when it becomes a little bit difficult for certainly younger radiologists, and they might consider this a lipoma. So next time you see this, you can say, oh, okay, this is just a pseudolesion, it's subcutaneous fat tissue, has no clinical meaning, it's present in about 14% of cases. So don't worry, don't touch it, don't biopsy it. Just move on and focus on the real pathology in your actual case that you see, like in this instance here, a osteochondral lesion.